Wonderful. So thank you so much for giving me the time to talk about a poster, which I presented at PAS a month ago. And this is about improving access to home IV antibiotic therapy, OPAT, for children throughout the province of BC. This was a team effort with an ID fellow, a statistician, and a number of other team members. So in the background, BC Children's Hospital is a large tertiary hospital that fits within a very large province, much like many in Canada. And we have very limited access to home care services outside of the metropolitan Vancouver area, which leads to, in the pre-study period, up to 10% of patient days on our ward were spent with patients who are clinically well, receiving long courses of IV antibiotics. So that led to us developing a team with the aim to increase the number of children accessing OPAT in BC. This started in 2023, and our goal was to increase our capacity for OPAT by 50% by the end of 2024. And we used a variety of traditional QI methods, sprint sessions, sort of long design sessions with patient partners and other stakeholders, driver analysis, PDSA cycles, et cetera. And we had a prospective REDCap database to capture clinical data. And so to make a very long story short, we developed a new clinical model that could reach patients anywhere in BC or Yukon. This is a caregiver-administered model in which caregivers are trained to access the central line, use simplified pumps to give IV antibiotics, and then they have regular, weekly, and as-needed virtual support from the Pivot team, which is our home IV antibiotics team at BC Children's Hospital. This is also a partnership model with in-person care in their community. This could be a pediatrician in a community hospital. It could be a nurse in a local health center, essentially anyone who can provide hands-on care in their local community. If you're curious what this looks like, this is just a demonstration of a parent giving IV antibiotics on their kitchen counter. This is an Instagram video that was shared publicly. And so we ran this study as a prospective cohort analysis of clinical outcomes, complications, and care processes using sort of standard buckets of outcome measures, process measures, and balancing measures. And this was run as a QI project. Sort of, over time, I think in retrospect, we're really analyzing it more as a pure cohort study. And initially, we were planning on comparing between an inpatient cohort and an outpatient cohort, but we actually were unable to recruit for the inpatient cohort. Basically, nobody wanted to continue with the current model of care, and everyone just went into our program. So we weren't able to do it as a double cohort comparison. We were just looking at our single cohort. And so in a 2-year study period from January 2023 until the end of 2024, patients who originated as inpatients in BC Children's Hospital were eligible to be recruited into our new team. We had 148 consults. There was about 50 patients who did not enroll. The number one reason was other, and this was nurse entered data in our REDCap database, so we don't have a lot of details about that, but where we do have details, the number one reason was actually that they didn't need to be on long courses of IV antibiotics. They were able to be switched to oral antibiotics when we consulted. And so of the 100 patients who were enrolled, we were able to include them in our analysis. This is just a description of where the patients went home to. So you can see the big star is BC Children's Hospital. It's in Vancouver. Metropolitan Vancouver is in this square. And you can see, I think what's most impactful about our new model is that we're able to have patients throughout the province. And more recently, we've even had a couple of patients in Yukon in the territory. And so about a third of the patients existed outside of the urban region where they had no ability to access regular inpatient care at BC Children's Hospital, which is the typical model of care to come back and see either ID physicians or general pediatricians on a regular basis for clinical assessment. So we were able to reach a very large geographic audience. We have lots of tables about who the patients were, where they came from, referring service, that sort of thing. What was included in this poster was just their age and some of their demographics, as well as what types of infections they were. And really, I think what this shows is that we saw the full range of patients who would be admitted to pediatric hospital medicine were able to access our program. We did do a sort of standard statistical process control chart, like a good QI project. I actually think in retrospect, this maybe was not the best way to display the data because we really launched a new program and then everything was different after that. So it's really more of an implementation of a new program rather than a QI project where you might do lots of little tweaks over time that gradually increase things. But this was included in our poster and really just displays that there was not as many patients and then there were more patients. Um, we compared outcomes and were able to show that patients who lived close to BC Children's in Metro Vancouver had similar treatment failure as well as OPAT-related complications. And this is also similar to the literature, which shows about a 10 to 20% complication rate in these patients with a less than 5% serious complication or treatment failure rate. So this will be the first, when we publish this as a paper, will be the first of its kind to show a broad rural geographic reach for pediatric OPAT. There's other literature from Western Australia for adults, which has similarly shown outcomes like this, but this will be the first of its kind to show this type of reach for a program. And I think it's generalizable in that many regions have a single children's hospital and then a lot of kids who live elsewhere who have very limited healthcare services in their region. We are currently doing a mixed methods patient experience study with our patient population on an ongoing basis. We're doing an economic analysis, and I hope to do a national survey in the future to see where OPAT is available. So thank you very much for your time, and it was a pleasure to present.
Great. That's really impressive work, Tom. Thanks for sharing. I don't know if we have maybe time for one quick question before we move on. There's one. Okay, that's great. Thanks, Tom. That's impressive work. And if anyone else has other sort of projects or updates they want to share and want to put in kind of a short format, please let us know and we'll be happy to include it.